bioterrorist attacks are an urgent and a continuing threat. And I'm honestly surprised and actually shocked that some of the recommendations made 6 or 8 years ago have not been implemented, and that even after the Ebola response, if we can call it that, we cannot seem to identify the federal official.
Congresswoman Martha McSally of Arizona discussing the threat of bioterrorism and America's preparedness to respond to it. That concern is also the focus of a blue ribbon study panel on biodefense that is about to release its findings. Welcome back to Newsmax Prime. I'm J.D. Hayworth. Our response to last year's Ebola scare provided insight into just how unprepared the U.S. may be for a bioterrorism attack. When the Ebola virus was found in the U.S., the initial response exposed some confusion and perhaps a weak crisis response system. But now that the Ebola threat has subsided, is the U.S. any more ready should an epidemic or a chemical or biological attack occur? Let's welcome in the co-chair of this blue ribbon panel, former United States Senator Joe Lieberman of Connecticut. Joe, it's good to have you here on Newsmax Prime.
Thanks, JD. Good to be with you and good to be on Newsmax. I've known and admired Chris Ruddy, the godfather of Newsmax, for a long time, so it's good to be on.
And it is great to have you here on Newsmax TV. Now, Joe, give us a sneak preview of what the report of this blue ribbon study panel is going to offer.
We are finding that America is still vulnerable, and that vulnerability is really strategically significant. The threat grows larger. ISIS and other terrorist groups continue to talk about using weapons of mass destruction, particularly chemical and biological. And as we know, traces of sarin and ricin have just been found in Syria in the last month. Infectious diseases seem to be spreading more rapidly, just as people travel more. Animals travel more, carrying, including birds, carrying disease. And we're unprepared for what might be called the big one here. So hopefully we're going to make some recommendations in September to Congress and the administration and the presidential candidates that will lead to some action that will close these vulnerabilities and better protect our people.
So, Joe, you're co-chairing the panel, and I just heard the word unprepared. Back in 2010, a similar National Security Commission gave the U.S. a failing grade. Have we gone from F to worse, in your opinion, when it comes to the specter of bioterrorism?
Yeah, fair question. I would say we haven't gone worse than F, but at best we're at a D. In other words, some things have come along. We have a system called BioShield, a lot of detectors out there to detect a biological or chemical incident. There's many places in the country, but not all, a public health system that's ready to respond. But and there have been some new drugs, so-called countermeasures, that have been developed as a response of federal investments to deal with either an infectious disease outbreak or a bioterrorist attack. But are we ready enough? No way. We are not. And I think that's what we want to focus on. One of the big problems here is a lack of leadership. I mean, we saw it in the Ebola crisis. It was not clear who was in charge. In the end, President Obama brought in a Washington lawyer from outside to coordinate the response, but that's not where you want to be when people in the country are in danger of being victims of a pandemic. The most important work to be done by a leader in a bioterrorist pandemic prevention response team is between crises, not when the crisis breaks out.
Well, obviously you're working to get the final recommendations in line by September. But as we're talking right now, Joe, if there is one thing you want the American people to know about this specter of bioterrorism, what would that be?
Well, I mean, it's a funny response to it. It's that we've been damn lucky that we haven't been attacked more with bioterrorist weapons by terrorists because they're relatively easy to put together and move around. Certainly, much more than a nuclear weapon or a dirty bomb, for instance. But I think the main thing we need to do is to put somebody in charge of this for the federal government. And then the second thing is to create the kind of public-private partnerships that have led us to have the best defense in the world. We're going to need some of the same to have the best biodefense in the world, because the market itself won't support the money that needs to be spent to develop vaccines for treatments or diagnostics for surveillance systems.
Former Connecticut Senator Joe Lieberman, we thank you so much for your time and insights, and we hope you'll keep us posted as the report comes out. Obviously, we're going to have a lot to talk about in the days ahead.
Thanks, JD. Thanks for your interest in this. I wish you well, and I look forward to talking to you again soon.
And Newsmax Prime continues right after this.